bones are divided into axial skeleton and appendicular skeleton. Bones in the midline, those are the axial skeleton bones. Okay, so skull bone is axial skeleton, then the vertebral column is axial skeleton, then sternum, again axial skeleton, sternum along with the ribs. Okay, skull, vertebral column, sternum, ribs. Vertebral column, when we say vertebra along with the sacrum, okay, entire thing is axial skeleton. Okay, and appendicular skeleton, it includes the bones of the limbs. Okay, the bones of the upper limb. So quickly try to recap the names of bones of the upper limb. Yes, one bone which is lying horizontally, which bone is that? This bone is clavicle, this bone is scapula, this bone is humerus. Then there are two bones in the forearm. This one is the lateral bone is radius, the medial bone is ulna. Then there are carpal bones, 8 carpal bones, and then metacarpals and phalanges. Okay, metacarpals are 5 in number, and then there are phalanges. Okay. Then let's see bones of the lower limb. Yes, identify the hip bone, 2 hip bones. They are connected in the midline by a joint, pubic symphysis. Okay. So hip bone, then femur, then this one is patella. Then in the leg there are 2 bones, tibia and fibula. Okay. Tibia and fibula, which bone is medial? Tibia is medial and fibula is lateral. Okay. And then there would be tarsal bones, just like there are carpals in the upper limb. Here there are tarsal bones, metatarsals and phalanges. Okay. So all these are the bones. So classification of the joints, it is done in 3 headings. Okay. Fibrous, cartilaginous and synovial. Okay. And what is a joint? General definition everyone might be knowing, right? It's the part of the skeletal elements where the bones are meeting and articulating. Okay, that is referred to as a joint. Okay. 3 types of joints are fibrous, cartilaginous and synovial. Okay. There might be some other functional classification as well, like synarthrosis, amphiarthrosis, diarthrosis. Those terms you might have learned as functional classifications like immovable, slightly immovable, freely movable. Okay. But in anatomy, we expect this classification is called as structural classification of the joints. Okay. Structural classification means based on the structure. For example, if there is one bone here, and they are connected by a fibrous tissue. Okay, fibrous tissue is basically a connective tissue which is connecting the 2 bones. Okay, so structurally there are 2 bones, in between them there is a fibrous tissue. That's why the heading is fibrous joint. Okay, in cartilaginous joints, 2 bones will be connected by intermediate tissue. So here the tissue will be a cartilage. Okay, you know what is a cartilage? There are different types of cartilage: hyaline cartilage, elastic cartilage, fibrocartilage. Okay. In between the 2 bones, if there is a cavity, then it is a synovial joint. Okay, supposing this is one surface, there is another surface of the bone, and there is a capsule surrounding it. Okay, inside there is a membrane called as synovial membrane. Okay. If the joint is somewhat like this, with a capsule, with a cavity, with a synovial membrane, okay, this cavity is referred to as synovial cavity, which is filled by a fluid called as synovial fluid. Okay, so if there is a fluid inside it, this kind of joint is referred to as a synovial joint. Okay, generally this synovial joints will freely allow movements. Okay, so understood structurally how in between 2 bones, if there is a fibrous tissue, then it is a fibrous joint. In between 2 bones, if there is a cartilage, then it is a cartilaginous joint. In between 2 bones, if there is a cavity filled by a synovial membrane, filled by a synovial fluid, okay, and covered by a capsule. Always all synovial joints will have a capsule covering it. Okay, as a rule, all synovial joints will have a capsule covering it. Okay, so structural differences you understood: fibrous, cartilaginous, and synovial. Now let us understand further subdivisions. There will be further classification. There are many, some subheadings under fibrous, some subheadings under cartilaginous, some subheadings under synovial. Okay, so that one by one we'll learn now. Skeleton model is there. So with the example also I'll show you. Okay, let's start once again. Fibrous. Again, it has got three further subdivision. Okay. First heading in fibrous is sutures. Then there is syndesmosis. And the third heading is gum forces. Okay. Fibrous joints are further classified under three headings: sutures, syndesmosis, and gum forces. Okay. Suture, everyone knows where is the suture present in the body, right? Skull bones. Okay, skull bones, they are connected by sutures. Okay, so example is skull bones. Okay, please one or two examples in each heading you are supposed to remember. Okay, fibrous joint. So basically there is one bone here, another bone here. The fibrous tissue is a like it's a connective tissue. That's a fibrous joint. So that's a suture. There are further classification of sutures as well that we'll discuss later on. For now, just remember sutures are present in skull bones. Okay. Syndesmosis. Syndesmosis, it is a like broad sheet of fibrous tissue which is present between radius and ulna, between tibia and fibula. Okay. Tibia and fibula, radius and ulna, they are connected by a fibrous membrane. Okay. The upper limb, radius, ulna, you know, so they are connected by a membrane called as interosseous membrane. Okay. The membrane is interosseous membrane. The word inter means in between. Osseous means between the bones. Okay. So basically interosseous membrane. So name of that structure itself is interosseous membrane. Interosseous membrane between radius and ulna, and interosseous membrane between tibia and fibula. Okay. So these are examples of syndesmosis. That is the interosseous membranes between radius and ulna and tibia and fibula. Okay. Then gum forces. Gum forces is specifically present in the tooth. Okay, tooth which articulates with the socket, also referred to as peg and socket joint. Okay, there is tooth that will articulate with the bony socket. Okay. The bone for the lower jaw is different, bone for the upper jaw is different. Okay, lower jaw the bone is mandible. Okay, upper jaw the bone is maxilla. Okay, the tooth with articulates with the bone. That joint is referred to as gum forces. Okay, specifically is present in this region only. Okay, so understood three types of fibrous joints: sutures, syndesmosis, and gum forces. Okay. Now I told you there are further sub-classification in sutures. I'll just give an overview and examples we'll see later on. Like if there are plane surfaces between the two bones, it is referred to as plane suture. Okay. If the articulating surfaces are like this, okay, if articulating surfaces are like this, like a saw, okay, these are the ends where the bones are articulating. Okay, these are not plane, these are like a saw. This kind of sutures will be referred to as serrate suture. Okay, understood? If there is a plane surface, it is referred to as plane suture. If there is a saw-like articulating surface, it is referred to as serrate suture. Okay, then if there is a articulating surface which is like this, okay, one surface is like this, another surface is like this. Okay, how does it look like? On one side, look at this. These projections are like tooth-like projections. Okay, on both the sides there are tooth-like projections are there. If there are tooth-like projections, then it is referred to as denticulate suture. Okay, denticulate suture. Okay, if there are plane surfaces, it is a plane suture. Saw-like, there is a serrate suture. Tooth-like, it is referred to as denticulate suture. Okay. Then there could be surface which is plane, but it is obliquely plane. One surface is like this, other surface is like this. Okay, here it was vertically plane, exactly like vertical, but there could be obliquely plane articulating surface. That kind of suture is referred to as squamous suture. Okay, the word squamous means flat. It's like it's becoming flat. The surfaces are becoming flat. Okay, so 4 different types of sutures I told you just now. Just try to remember them. That if the articulating surfaces are plane, it is a plane suture. If there is a saw-like articulating surface, it is a serrate suture. Tooth-like articulating surface, it is a denticulate suture. Flat articulating surface is a squamous suture. Understood? 4 different types of sutures. 1, 2, 3, and 4. Okay. Now let's understand cartilaginous. Cartilaginous joints are further classified into primary cartilaginous and secondary cartilaginous. Okay. I've written short forms here, you can write completely. Okay, primary, okay, primary cartilaginous and secondary cartilaginous. Okay, cartilaginous joints have further 2 subdivisions: primary cartilaginous and secondary cartilaginous joints. Okay, so where is primary cartilaginous joint present? You know, a growing long bone where there is a growth plate of cartilage. Okay, at the ends of the long bone between the diaphysis and the epiphysis, there is a growth plate of cartilage which helps in bone growth. Okay, so that is a plate of hyaline cartilage which is present there. So that joint is referred to as a primary cartilaginous joint. Okay, so it would be present in like children's only. In adults, that joint is fused now. Now that joint is not present there, but in children's there is a joint there. So you can write as the growth plate cartilage. Growth plate cartilage is an example. Primary cartilaginous joints are usually immovable joints. Okay, there is no movement possible at that joint, and secondary cartilaginous joints will allow some movement. Okay, and there is one more difference. Structurally, there is one difference. In general, I told you between 2 bones there is a cartilage, then it is a cartilaginous joint. Okay, there is some structural differences between primary and secondary that I'll make you understand now. For example, if this is the bone, between them there is a hyaline cartilage. Okay, between them there is a hyaline cartilage. It is a primary cartilaginous joint. Okay, this is one bone. This is one bone. Again, there is very small part of hyaline cartilage here, and the major chunk of tissue is a different cartilage that's called as fibrocartilage. Okay, the major chunk between the 2 bones is a fibrocartilage. Okay, fibrocartilage is there. Okay, hyaline, fibro, and elastic. There will be types of cartilage, out of which we discuss hyaline and fibro. Elastic cartilage doesn't come in between the joints. Okay. I'll just write the examples again. Primary cartilaginous, one is growth plate cartilage, and other is first chondrosternal joint. So note the terms. Why I've mentioned chondrosternal. The word chondro referring to the cartilage. Okay, chondro means cartilage, and sternum means it is articulating with the sternum. I'll just zoom in and show you where is the joint exactly present. Just look at it. This is the first rib. Anteriorly, it is coming and articulating in this part. Okay, the first rib which comes and articulates with the sternum. So basically, rib at one point it will get articulated with the cartilage. Okay, so this cartilage is now articulating with the bone. Okay, the cartilage word is referred to as chondro. That's why the name of the joint is first chondrosternal joint. Understood? So it's basically this joint. Okay, joint between the first rib and the sternum. So basically the cartilage element articulates with the sternum. Name of the joint is first chondrosternal joint. Understood? Then secondary cartilaginous joint. Let us learn examples. For secondary cartilaginous joints, you can remember midline joints. Okay, almost all midline joints are secondary cartilaginous joints. So when I say midline joint, we can see in the midline there is the vertebral column, joint between the body of the vertebrae. Okay, the name of that structure is referred to as intervertebral disc. Okay, in between the two body of the vertebrae, it is a intervertebral disc. Okay, so basically intervertebral disc is there, that tissue, it's a fibrocartilage. Actually, I told you main chunk of tissue between the bones is a fibrocartilage. Okay, in secondary cartilaginous joint, uh, there is this intervertebral disc. That is an example, intervertebral disc, and it is specifically joint between the bodies of the vertebrae. Okay, because in between the two vertebrae there are some additional joints as well. Vertebrae have got projections called as articular facets. There are two superior to inferior articular facets which are present. That is a different kind of joint. Okay, the facets which articulate, those are actually a plain variety of synovial joint. Okay, so between the vertebrae you have to be specific. That is joint between the body of the vertebrae is the secondary cartilaginous joint. Okay, then in the lower limb bones I showed you two hip bones are articulating anteriorly. The pubic symphysis. Okay, that pubic symphysis is a secondary cartilaginous joint. Pubic symphysis. And here in the sternum we can see this upper part of sternum is referred to as manubrium of the sternum. Middle part is the body of the sternum. Lower part is xiphoid process of the sternum. Okay, the joint between manubrium and body here. This joint is a secondary cartilaginous joint. Okay, manubriosternal joint. Okay, so manubriosternal joint you can remember here. Okay, manubriosternal joint, it is a secondary cartilaginous joint. Is it clear? Primary cartilaginous joint and secondary cartilaginous joints examples we have discussed. Now let's understand classification of synovial joints. Synovial joint can be classified based on the articulating surfaces, based on the shape of the articulating surfaces. And there is also one more classification based on the number of bones articulating, whether there is an articular disc in between. Okay, first we'll understand the classification with respect to the shape of the articular surfaces. Okay, if there is a one articular surface like this, like a ball, and another articular surface like this, like a socket. Okay, on one side there is a ball like component and on other side there is a socket, and that kind of synovial joint is referred to as ball and socket variety of synovial joint. Okay, ball and socket variety of synovial joint. What are the examples in the body? Where is it present? Yes, one we can see here. The head of the humerus is forming the ball component. The socket is formed by the scapula. Okay, scapula has got one cavity called as glenoid cavity that forms the socket. Okay, so ball and socket examples are the shoulder joint, and similarly in the lower limb there is hip joint. Okay, when you see the upper end of the femur, it will look like a ball. The head of the femur looks like a ball, and the socket is formed by the hip bone. Okay, hip bone has got one socket. Okay, that name of that socket is called as acetabulum. Okay, acetabulum is a socket in the hip bone where the head of the femur will articulate. Okay, yes, the head of the femur articulating with the socket in the hip bone. Okay, so name of that socket is acetabulum. Okay, this one is easy. This is the head of femur. Okay. So at least these two examples try to remember in ball and socket variety of synovial joint. Okay. Okay, let's hinge joint is seen here that I'll cover now. Okay. The elbow joint is referred to as hinge joint. For hinge, you can remember as the hinge of the doors. Okay, doors can either open, can either close. Okay, it is a uniaxial movement. Okay, only one side. Either we can do flexion with the elbow joint. Flexion means when the angle is decreasing. Extension means when the angle is increasing. Okay. So synovial joint in hinge variety, the example is elbow joint. Okay, and also you can think about the fingers. In fingers, there are proximal interphalangeal joint and distal interphalangeal joint. Okay, when you bend the distal part of the finger, either you can flex it and either you can extend it. Okay, only unidirectional movement is possible. Okay, interphalangeal joints. Okay, so in variety elbow joint, interphalangeal joints. And also, just like elbow, you can compare in the lower limb as knee. Okay. Functionally, knee joint is also a hinge joint. In knee, we can either do flexion of the knee, we can do extension of the knee, right? Functionally, knee joint is also included here. Okay. So elbow joint, knee joint, interphalangeal joint. These are hinge variety of synovial joints. Okay. Then let's see another heading. So two headings we covered till now. One was ball and socket and hinge. Then let's see another variety. Let's cover the easy one first. Plane variety of synovial joint. Okay. There are two articulating surfaces which are plane. Okay, but still there is a cavity, there is a capsule. So that kind of synovial joint is a plane variety of synovial joint. The articulating surfaces are plane. What are the examples? The carpal bones which are there, the joints between the adjacent carpal bones, those are plane variety of synovial joints. Okay, articulating surfaces are plane. The small carpal bones, right? 8 carpal bones. In between the carpal bones, the joint is a plane variety of synovial joint. Okay, the intercarpal joints. Okay, intercarpal joints. Intercarpal joint is a plane variety of synovial joint. And look at the clavicle bone and look at the lateral end of the clavicle. Lateral end of the clavicle is articulating with which bone? Scapula, right? Which part of the scapula? Acromion process. Okay, there is a part of scapula called as acromion process. Okay, and this bone is clavicle. The name of the joint here is acromioclavicular joint. Okay, the lateral end of the clavicle articulating with the acromion process of scapula. Name of the joint is acromioclavicular joint. That is a plane variety of synovial joint. Okay, acromioclavicular joint. Okay, so at least try to remember these two examples in plane variety, intercarpal joints and acromioclavicular joints. Okay, so let's see one heading called as saddle variety of synovial joint. Saddle variety means the articulating surfaces are concavo-convex. Concavo-convex. What does this mean? The word saddle, it comes from the saddle of a horse. Okay, saddle of the horse means the place of the horse where we sit. Can you imagine the horse upper part where we sit? Side to side it is convex. Okay, but antero-posteriorly it is concave. Okay, so side to side it is convex, antero-posteriorly it is concave. If the articular surfaces are like a saddle, it is referred to as saddle variety of synovial joint. Okay, where it is present in the body. Yes, any example you know of saddle variety? So specifically the first carpo-metacarpal joint. The first carpo-metacarpal joint. Where is it present? First, the metacarpals. Which one is the first metacarpals number wise? The thumb side, the metacarpal which is present, that's the first metacarpal. Okay, the first metacarpal. Look at the base of the first metacarpal. It is articulating with one bone. Okay, this one is the first metacarpal. It is articulating with one bone. Name of that bone is trapezium. Okay, first metacarpal. Okay. The first metacarpal is articulating with the trapezium. This joint is the saddle variety of synovial joint. Okay. First carpo-metacarpal joint is a saddle variety. Then you can remember one more example with the clavicle only. Clavicle one end we had learned is a plane variety of synovial joint. Other end of the clavicle, that means medial end of the clavicle which articulates with the sternum, that is a saddle variety of synovial joint. Okay, first carpo-metacarpal joint. So this joint will be named as sternoclavicular joint. Sternoclavicular joint is a saddle variety of synovial joint. Okay. So which headings we had covered in synovial? We covered ball and socket, we covered hinge, we covered plane, we covered saddle. Okay. In your mind, try to remember at least two examples in each heading. Yes. Any other heading which is left? There is one called as ellipsoid. Pivot is left. Okay, and there is one condylar, also referred to as bicondylar. Let's see examples in these. Ellipsoid variety of synovial joint. Ellipsoid means, again, articular surfaces are concave and convex, but it is not as much convex to call it as a ball. Okay, so articulating surfaces are like one side it is convex, another side it is concave. Okay, but this convexity is not so much big or so much rounded to call it as a ball and socket. Okay, structurally these joints will look like this: one side convex, other side concave. Okay, examples are this joint is an example. When I draw this shape like this, it doesn't mean that only one bone is here and one bone is here. There could be multiple bones which may make this convexity. Okay, and another bone, or could be multiple bones that could make that concavity. Okay, for example, if you see this joint, the radius is articulating with the carpal bones. Okay, carpal bones are multiple in number. Okay, the carpal bones make that convexity, and concavity is formed by the lower end of the radius. Okay, the wrist joint comes as an example here. And now one more example is here between the metacarpal and the phalanges. Okay, the metacarpophalangeal joint, look at the articulating surfaces. One side is convex, other side is concave. Okay. Metacarpophalangeal joint. These two examples try to remember in ellipsoid variety of synovial joint. Okay, wrist joint and metacarpophalangeal joint. Now, pivot variety of synovial joint. The movement will be around the vertical axis. Okay, rotatory movements are possible at pivot variety of synovial joint. Example is again in the upper limb bone here, the upper end of the radius which articulates with the ulna, okay, as well as the lower end of the radius which articulates with the ulna, which helps for these movements. These movements are referred to as supination, pronation. Okay, when the palm is facing upwards, it is supination. When the palm is facing downwards, it is pronation. These rotatory movements are possible at the superior and the inferior radioulnar joints. Okay. So superior radioulnar joint and inferior radioulnar joint, these are examples in pivot variety. Yes, superior radioulnar and inferior radioulnar. These are examples in pivot variety. And also atlas axis bones, you know, atlas axis, cervical vertebrae. The first cervical vertebrae is atlas, second cervical vertebrae is axis. Second cervical vertebrae has got a projection called as odontoid process that articulates with the axis. Okay, so that articulation between the axis and the atlas in the midline. Okay, so the name of the joint is referred to as median atlantoaxial joint. Understood the examples of pivot variety. Okay, now only this condylar variety is left. Condylar is basically where two condyles are making the formation of a joint. For example, the knee joint, there are two condyles of the femur like this, which articulate with the two condyles of tibia. Okay, condylar are basically bicondylar joints. The two condyles will articulate with the adjacent bony surfaces. The knee joint functionally it is included in hinge joint as well, and structurally it is included here in bicondylar variety as well. Okay, because the lower end of the femur it has got two condyles. Okay, if you want to see, I'll show you here. There is a posterior view. You can see the two condyles of the femur. Okay, two condyles of the femur articulating with the tibia. Okay, basically a bicondylar joint. Okay, and you see the mandible articulating with the skull. So temporomandibular joint is also included as an example here. Temporomandibular joint. Okay, the joint which helps in jaw movement, chewing movement, whatever. That is the only joint in the skull which is movable. Okay, all other joints in the skull are like fibrous joints. Okay, they are immovable. Okay, now the only joint in the skull which is movable is temporomandibular joint. Okay, that joint is included in bicondylar variety. Okay, understood different types of synovial joints with examples. So this was one classification with respect to the shape I told you. Okay, there is one more classification of synovial joint with respect to the number of bones which are articulated. and also there might be a disc called as articular disc in between the articular surfaces. Okay. Try to explain you now. So if there are normally in any joint we say like two bones are articulating and forming a joint. Okay, but if there are three bones which are coming and they are articulating to form a joint, for example elbow joint, upper part is humerus, radius and ulna. Okay, if there are three bones which are articulating to form a joint, then that kind of joint is referred to as compound joint. Okay. When two bones are articulating, it is referred to as a simple variety of synovial joint. It is just based on the number of bones, and this classification will, the examples will overlap with the classification that you had learned previously. Okay. Any bone which is having two bones, it is a simple joint. Any bone which is having three bones or more than two bones, it could be four bones, five bones, any number of bones. More than two bones, it is a compound variety of synovial joint. Okay, simple, compound, and there is a third heading called as complex variety of synovial joint. So what does this mean? There is one bone, there is another bone, and in between them there is something separating them. That something separating structure is referred to as articular disc. If an articular disc, it is a fibrous tissue which is present. Fibrocartilage basically is there between the surface. Okay. But still joint cavity is there. Here also there is a joint cavity. In the upper part also there is a joint cavity. It is not that it is completely fixed and immovable. This knee joint, if you see, the condyles of the femur are quite large, but the corresponding tibia is not that much concave. Okay, so there is one articular disc in the form of menisci which is present. Okay, menisci. Okay, sports players, you might have learned about meniscal injury, meniscal tears. Okay, in knee joint there is something called as menisci between the articulating surfaces. Okay, so if that menisci is present, then that kind of joint will be considered as a complex variety of synovial joint. Okay, whenever there is an articular disc separating the two joint surfaces in a synovial joint, it is considered as a complex variety of synovial joint. Okay, so if you see the knee joint is included in compound variety also, it is included in complex variety also. Why compound? Tibia and femur and patella, these three bones are taking part in the formation of knee joint. Okay, remember fibula is excluded from the knee joint. Fibula is not a part of knee joint. Okay, structurally also you can see from the skeleton which is there. Okay, just look carefully at the fibula. Fibula is not going towards the articular surfaces. Okay, fibula is lower down. Okay, just articulating with the tibia, it is not a part of knee joint. Okay, so there might be joint which is both compound and complex. And also temporomandibular joint we learned. Temporomandibular joint, that also has got an articular disc in between the surfaces, that is also included in complex joint. Okay, so two examples of complex you can mention, knee joint and TM joint. Temporomandibular joint is abbreviated as TM joint. Okay, temporomandibular joint. Okay, is it clear? So we have covered all classification with examples. There is one PDF notes that I have made for this. Okay, so bones in general we learned different names. Names of bone, first page is just to get an idea of different bones which are visible. The next page, look at this image. Three types of joints, three basic types of joints is shown in this image. Fibrous joint in the skull, cartilaginous joint between the body of the vertebrae, a synovial joint, right, which is having a cavity. This image shows the general structure of a typical synovial joint. Okay, here it is mentioned structure of a typical synovial joint. Okay, there could be a compound synovial joint, there could be a complex synovial joint. For that, the structure would be different. Okay, in general, the synovial joint, look at the structure: a joint cavity, an articular cartilage covering the ends, then fibrous capsule. Okay, understood? Structure of a typical synovial joint. And look at the examples. I think it's not very clear. I'll just zoom in. Clear now? Okay, examples we can show in this table. You can just read from here. Okay, the classification which I taught you, everything is mentioned in these notes. General definition of joints and three basic headings: fibrous, cartilaginous, synovial, sutures present in skull, syndesmosis, middle radioulnar joint, middle tibiofibular joint, omphosis. Okay. Then look at the cartilaginous joint. Primary cartilaginous is also referred to as synchondrosis. Secondary cartilaginous joint is also referred to as symphysis. Okay. Look at the examples that we discussed. At least two we would have discussed, but additional also is mentioned here. Okay. Then synovial joint. There is classification with the examples. Just read it. We have already discussed it. Read down also. Classification based on the number of bones as well as the articular disc. In simple, only two bones articulate. In compound, more than two bones articulate. In complex, the surfaces are separated by an articular disc. And these are diagrams, schematic diagrams for the fibrous joint, cartilaginous joint. Okay. These diagrams are showing the concept of simple, compound, and the complex variety. Okay. Simple means only two bones are articulating. Compound means more than two bones. And in complex, there is an articular disc in between. Okay. This gray colored thing that you can see in between the two bones, that's the articular disc. Okay. And here look at the different types of sutures that we discussed: plain, serrate, denticulate, squamous. There's one more heading called as skin dialysis. Okay. Examples are mentioned here. Okay. There's a specific shape here in skin dialysis, like V-shaped articular surface and a corresponding other bone. Okay. So different examples of plain, serrate, denticulate. These examples you may not be able to remember now, but when you learn about the head, neck, skull, when you learn, then you come back here and try to remember the examples. Then applied anatomy of joints. So whenever we learn something, there should be some applied anatomy related to it, right? That's why we are learning. There's something called as Hilton's law. What does Hilton's law say? A nerve to the muscle acting on a joint gives a branch to that joint and also supplies the skin covering the joint. Okay, what does this mean? For example, if we take an example of elbow joint, okay, the muscles acting on elbow joint, we see flexion of the elbow joint is brought about by biceps brachii muscle, brachialis muscle. Let's take one example of biceps brachii. Biceps brachii, it is supplied by a nerve called as musculocutaneous nerve. Okay, musculocutaneous nerve. So since biceps brachii muscle is acting at the elbow joint, that nerve will also act at the elbow joint. Okay. So elbow joint capsule, it will be supplied by that musculocutaneous nerve, and also skin covering the elbow joint, it will be supplied by that same nerve. Okay. So this was described by scientist Hilton. Okay, again try to read this. Nerve to the muscle acting on a joint also gives a branch to that joint and also supplies the skin covering the joint. Okay, any joint, if a question is asked, if you don't know about the nerve supply of that joint, you can think about muscles acting at that joint. Okay, and you can write those nerves. Okay, so these nerves will be supplying that joint. Understood? There might be inflammation of the joints called as osteoarthritis, rheumatoid arthritis. Sprain is actually the ligaments which cover the joint that can get inflamed. That's called as joint sprain. Joints can get dislocated in injury, and many a times due to fracture, joint replacement surgeries are to be done. Okay, so anatomy of joints you should know for all these applied concepts. Okay.